Hi friends, I'm David Esrati. I'm a candidate for Congress, Ohio 10, which includes all of Montgomery County, all of Greene County, and parts of Clark County. And today we're going to talk about health care. Why are we going to talk about health care today? Because I have good health care and you probably don't, unless you're Congressman Mike Turner. I get my health care through the VA. That's the Veterans Administration, and that's what we call government health care. And there's all these people say, oh, I don't want the government doing my health care, and they prefer some rich insurance company to make decisions for you. That hasn't worked out so well. The United States is the opposite of Target. Target says, spend less, get more. Well, here we spend more and get less than any other advanced country in the world. And we do it consistently. And if you want to know why we do that, it's because we allow private corporations to profiteer in healthcare. But back to why we're talking about this. Well, I found out that my rotator cuff on my right shoulder is completely torn. And yes, I'm going to need surgery soon. So you're going to see, we're going to have to kill the live stream for a few days when we get this scheduled. And then I'll be sitting here with a sling, and that'll be loads of fun because I am right-handed and the furthest thing from ambidextrous there ever was. So, wish me luck. And that means I got to count on all of you to understand that it's really important for you to go and talk to your friends, talk to your neighbors, talk to people you know with money who want to see things change. And we've got to bring health care to everybody in this country, because if you're not healthy, you can't work, you can't make money, and you can't pay taxes. Make sense? Does in other countries, not here. We have a system where we have hospitals being run by people making $4 million a year right down the street from us. They got marble walls, they've got, fountains, they've got all this neat stuff. That's not necessary for healthcare. What's necessary for healthcare is doctors and nurses, not people doing claims adjusting and insurance and billing. Because frankly, here's the crazy part. And this is the part that I just don't understand. If you don't have insurance and you show up at the hospital and you are injured, they're going to treat you. Yeah, they're going to treat you. And if you don't have any money, they're not going to bill you. They're going to bill the federal government, which is all of us, because we pay those taxes. And we're going to pay for it anyways. Makes zero sense. It's absolutely ludicrous how we do things. In fact, what we do is we avoid preventative care. The care that makes sure that you stay healthy to avoid the more expensive things later. Like I have a friend who's a black man. He's 54 years old. And he's had health insurance and health care. But for some reason, his doctor wasn't giving him a PSA test every year starting when he was 50. Guess what? He now has prostate cancer. So we had to do surgery once, and now it's come back, and now he's going to do chemo. That costs extra. Had they done their job and done that PSA test, probably would have caught it early and saved a whole lot of anguish and cost. We do the same thing with diabetes. We catch it late. We don't treat it properly. We don't work with people proactively. And then even more insane, we don't have things like dental or vision included in healthcare plans. The most important thing you can do is keep your teeth clean and keep your mouth free of bacteria and infection, because they've said that it leads to, get this, heart disease. So, not including dental care and health insurance is ridiculous. But health insurance is ridiculous. It's like gambling away, giving people money with the hope that you're not going to get sick or it's not going to cost us less than what you pay. That makes no sense at all. Meanwhile, the healthcare executives are making hundreds of millions of dollars a year. They paid one guy one year $144 million a year. There's no need for any of that. And it doesn't happen in other countries. You get sick, you go to the doctor, it gets taken care of. All the money we spend on processing all that paperwork, we could be spending it on cheaper med school, cheaper nursing schools, paying people to take care of people. We have no mental health care in this country. And we've seen the costs of lack of mental health care skyrocket through COVID. If it wasn't for the people losing their shit, it was also that they were committing suicide at a ridiculous rate. And that is not good for our country. We need people healthy, able to work, ready to work, happy, and it makes no sense. How about this? How about you get cancer and you need care? Basically, you have to declare bankruptcy in this country. GoFundMe is not health care, people. So, guess what? If I get elected to Congress, I'm not going to take the congressional health care plan. I'm going to stick with my VA care. But whatever they offer me, they should offer you. Because if it's good enough for me, it's good enough for you. Ask your congressman why he doesn't have to pay through the nose. Ask him why he automatically gets a great health care plan. Ask him about how he gets dental and vision and all the rest of that. By the way, the VA does not give me dental, but they do give me vision. You have to be 100% disabled in order to get dental care or have dental problems when you're from the military, from your service. We can do better. We can do a lot better. So some people call it single payer. Some people call it Medicare for all. Some people call it universal health care. It doesn't matter what you call it. We just need health care. It shouldn't be chosen by your boss. It shouldn't involve things like HSAs and all this other crap. And we shouldn't have to buy our medicine like insulin at an astronomical 10 times what they charge any place else in the world. We have the ability to do group buys. We can get things together when we need it. It's pretty obvious that we've seen that we can find $54 billion in no time to send to Ukraine, and we can spend ungodly money on tanks and airplanes for our defense that we're not even using, but we can't keep our people healthy. It's time for a better America. It's time to stop voting for Republicans because, as my bumper sticker says, voting Republican kills Americans. We lost 1 million people during COVID because we didn't handle it well, because we didn't have people with primary care all the way through and easy access to health care. We can fix this. We can make a better system, and it doesn't have to cost. It doesn't mean doctors are going to go broke or hospitals are going to go broke. It just means we refocus where we spend our money. Instead of spending it on insurance and making more paperwork, we spend it on actual care. So, I'll be back on Monday, same time, same place. Please tune in, like and subscribe. Hit the little notify bell so you know when I come on. You can make a donation at electesrati.com/donate if you like what you hear. You can sign up to be a volunteer at electesrati.com/act. And you can share this video any place you want because it's time for healthcare in America where it is not pay more, get less. We need to turn it around and spend less and get more. Thank you for watching, and we will see you Monday. Have a great weekend.